One of the most important things that I think a patient needs to achieve after knee surgery is full terminal knee extension. And this is important because it helps with your gait, it helps with fluid management in the lower extremity. Ultimately, it helps with overall range of motion of the knee. So here are 5 exercises that I use with my patients to help restore terminal or full knee extension. So for the first exercise, what you're going to need is a chair, and you can use another chair or you can use a box. And what I tell my patients to do is to sit on one chair, place their heel on the seat of the second chair. And what they're trying to do is to allow the leg to sink in between, so you want no support here. And then you're going to take a weight. So here I'm going to just use my backpack, and you want the weight to be about 15 to 20 pounds, and you're going to place that over the lower leg, just below the knee. You don't want to put it on the knee, you're going to do just below the knee. And I often will have some arguments with physiotherapists about where to put the weight, and people will tell you that you can put it above, but you're going to provide much more extensive force at the level of the knee if you put it below. And because I'm a surgeon and I operate on the knee, this is going to be more protective if you are recovering from, say, a ligament repair in your knee, such as an anterior cruciate ligament reconstruction. So, bag over the lower part of the knee. You want to hold that. I usually tell my patients to do this twice a day, 20 pounds, 20 minutes. And you'll start to see results from this after 1 to 2 weeks of doing this exercise. The next exercise is banded passive knee extension. And so here we're going to place the band just above the level of the knee, and you're going to walk out until you have reasonable tension on the band, and then you're going to square your hips, square your feet, make sure that you squeeze your cheeks together, nice tight core, and you're going to allow the band to pull this leg backwards. And we're going to try to hold that position for 60 seconds at a time. And when you're done, you can walk back under control. I'll put it out to the side so you can see a little bit better. Step forward until we have some good tension with the band. Plant the feet, squeeze the glutes, and allow the band to pull back on that leg. And again, we're going to try to hold this position for 60 seconds at a time. You'll have a little bit of a slight lean forward to resist. And once you're done with this position, first you can slightly slide back that leg under control, leaning on your good leg, and then you can back up to when you have no tension left on the band. So the next exercise, we're going to use the band again. So for the first 2 that I showed you, those were both passive extension. So now we're going to start to recruit the quadricep and get some active extension. So we're going to use this band again. And previously, we had walked out and walked out forward. This time, what we're going to do is we're going to walk backwards again till we have some tension on the band. Then we're going to square our feet and we are going to extend the leg backwards. Actively contracting the quad against the resistance of the band. And let me switch up legs here to make it easier to see. And again, we'll walk out. So you have a bit of a bend in the leg. We're going to square the feet and then push all the way back. So now we're still extending the knee, but now we're doing it actively against resistance. And so when I do this, I'm going to try to do anywhere from 6 to 8, or if you're starting to regain more strength, 8 to 10 reps, 8 to 12 reps, and 2 to 3 sets. Now, to have good knee extension, you need to have several things, one of which is a good range of motion of the knee, i.e. flexibility around the level of the knee. But you also need to have nice, strong quads. So one of my favorite exercises that I'll prescribe for my patients that will help to restore active quadricep contraction is isometric bent leg holds. And so for this, very easy, simple to do. All we're going to do is we're going to bend the leg that we're working on, and we're going to bring the other leg up, and we're going to hold in a static position for 60 seconds at a time. And obviously this exercise, you need to have some reasonable balance. So if balance is an issue, because we don't want this to be a balanced exercise, then you can use a post or a pole, or you can put your hand close to the wall to do this, because we want you to be able to focus just on the hold rather than the balance. So you're going to be here and hold this position. You get your timer on your watch or your phone, and you can hold for 60 seconds. And you can do reps of 60 seconds. You can do 2 to 3 reps for each leg every time you're doing this. And again, this is not directly working on the flexibility of extension, but it is working on the muscles that contribute to extension, i.e. the strength of the quadriceps. If you're able to do reps of 60 seconds at a particular level of knee flexion, then you can start to increase the difficulty level by decreasing your height or increasing the amount of knee flexion that you are performing this hold in. Okay, and so you're going to do reps of 60 seconds. And so the last exercise that I like to prescribe for my patients, or have them do to work on knee extension, is a reverse Nordic hold. And again, we're not directly working on the actual act of extending the knee, but we are working on activation of the quadricep muscle, which is the primary muscle that will allow you to actively extend your knee. So for this exercise, what we're going to do is we're going to start out in a kneeling position. We want to make sure that our pelvis is not anteriorly tilted. So what we're going to do is squeeze our glutes, and we're going to extend this line in front, and then we're going to lean back into a hold. And we're going to try and hold this position for anywhere from 30 to 60 seconds at a time. And as you get stronger, you can start to go further back and hold in a larger degree of flexion. If you're not quite as strong, then you can hold here or hold at a smaller degree of knee flexion. But what we're doing here is we're really working on activating the quads, getting a nice active quad extension, and the further you lean back, we're turning this into an eccentric contraction where we are contracting the muscle but increasing its length at the same time. So you can hold this position, and ideally we're going to hold that position for reps of 60 seconds. Initially, many of you are not going to be able to do that, so you can start out and go for 15 seconds. Once you're comfortable with 15 seconds, work up to 30 and so forth, and eventually you'll be able to get up to 60-second hold. So that is the goal, reps of 60 seconds. And then again, to increase difficulty, not only do we increase the time, but we can also increase the distance that we are leaning back. And for sure, when you're doing this exercise, you're going to feel your quad light up, which is then going to help with the activation of that muscle. So when you go to extend the knee, you are better able to do so. So those are 5 exercises that I prescribe to my patients to help maximize your knee extension.